Hello, my name is Bianca Mitchell, and this is my remote collaboration and evidence-based care presentation for Nursing 4030. For this assessment, I am going to refer to the Villa Health case study provided for this assessment. In this presentation, I will propose an evidence-based care plan to help improve quality care and safe outcomes for the patient, explain which evidence-based practice model was used, identify what evidence was most relevant in developing the care plan, and identify best practices that could overcome challenges faced in the remote collaboration. The Villa Health scenario is based on a 2-year-old patient named Caitlin who has presented to the emergency room for the second time in 6 months. She is being seen for pneumonia and malnutrition and is later diagnosed with cystic fibrosis during this stay. Caitlin and her parents live an hour away from the hospital in a rural town. With Caitlin being so young, her parents will be responsible for her treatment to prevent repeated hospital visits. Both parents are employed, although money is tight due to dad being recently unemployed. The pediatrician, Dr. Copeland at Valley City Regional Hospital, has decided to use telemedicine to help Caitlin's parents be successful in her care. Dr. Copeland has decided to collaborate with the respiratory therapist, the registered nurse, and the pediatrician in Caitlin's hometown, Dr. Benjamin. In addition, she has also ordered a social worker consult to determine any social determinants of health. Dr. Copeland had already initiated a plan of care for Caitlin to help treat her cystic fibrosis. She ordered pancreatic enzymes, a high protein and calorie diet, and fat-soluble vitamins A, D, E, and K. NAREG and others added that lifelong pancreatic enzyme supplementation, high-calorie, high-fat diet, and supplements of fat-soluble vitamins and some trace elements are needed in a cystic fibrosis patient's diet, and that was written in 2017. In an article written by Mates and Denning in 2021, diet should also consist of additional salt since the body does not retain it, sufficient hydration, and avoiding fats that are hard to digest due to the malfunction of the pancreas. Due to Caitlin being admitted twice for malnutrition in the last 6 months, improving her nutrition should be of top priority for quality outcomes. Keeping patients with cystic fibrosis physically active is also recommended in an article by Mates and Denning in 2021. I would encourage, if possible, to incorporate routine outdoor play or even signing up for dance or ballet if financially feasible. Education for bronchodilators and chest physiotherapy has already been included by respiratory therapy and is credible treatment with cystic fibrosis. Providing follow-up education regarding medication adherence is essential to managing cystic fibrosis. Hand hygiene is the number one source for preventing infections, and cystic fibrosis patients are at high risk of developing an infection. Schintberg and others in a 2021 article stresses the need for good hand hygiene and cleaning of medical equipment and devices as part of the care plan. Educate, educate, educate. Educating Caitlin's parents will be a repetitive intervention that is essential in promoting healthy outcomes. The article I found most useful was written by Mates and Denning in 2021 because it was a personal reflection and education on cystic fibrosis by one who had been living with the diagnosis since she was an infant. This article listed everything from treatment to psychosocial to family support. I found this source to be most useful and credible by coming from an author with cystic fibrosis. I found the knowledge to action model to be the best fit when forming Caitlin's care plan. The purpose of this research was to educate the patient's family on what cystic fibrosis is and how to manage their daughter's care. The KTA model can be broken down into 3 phases in order to locate the most credible sources needed. The first phase is to identify the problem, which was newly diagnosed CF and lack of knowledge of understanding of condition. This phase includes identifying any barriers such as distance from closest hospital and living in a rural area. The next phase is to find and put interventions into place that could help overcome any barriers such as use of Skype calls and telemedicine consult with local pediatrician. The last phase is to monitor and evaluate the outcomes. For instance, are the parents following the plan of care, and is the telemedicine visits helping to keep Caitlin from being readmitted into the hospital? Having a strong interdisciplinary collaboration team is necessary for Caitlin to have a positive outcome. Effective collaboration via telemedicine can allow her to have a small sense of normalcy rather than taking road trips back and forth routinely, in addition to acutely for follow-up visits. Caitlin's local pediatrician, Dr. Benjamin, not having telemedicine set up with Valley City Hospital is a challenge in providing Caitlin with the best quality of care. Using another video call app or text messaging can help overcome this issue until Dr. Benjamin is able to join in with the hospital. Asking the social worker to locate nearby support groups for cystic fibrosis patients and families could be beneficial for coping with the new diagnosis. Also, seeing if there is a local respiratory therapist who could go over the chest physiotherapy in person again to prevent any further bruising from ineffective practice. It is vital that Caitlin and her parents have the proper education and resources to help manage her cystic fibrosis to the best of their abilities. Using an evidence-based approach to Caitlin's new diagnosis is necessary to have quality care and outcomes. Overcoming challenges from the interdisciplinary team collaborating will aid in keeping Caitlin healthy and out of the hospital. Through continuous education and telemedicine use, Caitlin parents have a fair chance at managing their daughter's condition well. Thank you.